50 and you watch the advertisements on television, you feel guilty if you don't take them. So are they any good? Should we be taking them? Should we all be taking them? Well, the age-related eye disease study showed that there was some benefit in the antioxidant vitamin supplements in people with macular degeneration in preventing progression of macular degeneration. And this occurred with people taking the vitamins A, C, E, and zinc. It did not show any prophylactic effect. So there was no benefit for people taking the vitamins if they did not have macular degeneration. The study was also funded by Bausch & Lomb. That's the maker of the biggest brand of the vitamins. Now, the Cochrane collaboration, a very large independent research organization, there's over 100,000 individuals that contribute to the Cochrane collaboration. And they review all of the published literature, all the published medical literature. They found in a study in 2012 that vitamin and mineral supplements had absolutely no effect on macular degeneration. Now, I used to recommend these vitamins to all of my macular degeneration patients, maybe some of you here. But I have changed my mind. And I took the Hippocratic Oath to do no harm. And as I'll explain a little bit, not only do I feel these vitamins are really ineffective in most people, they are probably very harmful in many people. Now, this is a perfect example of industry, the pharmaceutical industry, taking a little bit of science, distorting it fairly dramatically to make a huge profit. So they have a reason to do this. It's sort of like looking at the small picture, where organized medicine completely ignores, Mitch, would you turn those lights on? Completely ignores the large picture of using diet as a preventative measure. So same thing like taking cholesterol when you're taking cholesterol lowering medication because your cholesterol is high instead of doing something prophylactically. Cataracts. That's opacity of the lens related to decreased vision. It is the most common cause of blindness worldwide, regardless of age. Now this is a diagram of what cataracts do. Many of you may know this. A clear lens allows the light to focus through it onto the retina, onto the optic nerve in this case, and give you a nice clear image. But a cloudy lens, in this diagram you can see that, allows or doesn't allow the light to focus. It allows the light to be scattered, and so the image is very blurry. And cataracts do different things for different people. It's not one particular symptom, but this is the idea of what happens. And when we use those machines